Hi, my name's Phil. I like talking about politics, and in this video I'd like to discuss the reports that Sajid Javid, former health secretary, now Tory backbencher, has just come right out and said it. He says that the NHS should no longer be free at point of contact, that we should be charged extra for GP and A&E visits. In other words, an additional private levy should be applied at the 2 points of entry to all NHS services. But first, if you'd like to be notified of daily news and politics, please subscribe to the channel and click the bell notification icon. So the Conservatives have, of course, been in favour of privatising the NHS for quite a long time. I mean, no Conservative government has been in favour of it. They've sought to undermine it at every stage. That being said, previous Conservative governments seem to understand the need, at least for universal healthcare. They just didn't like the lack of profit driving it. Ever since the current incarnation of the Tories came to power in 2010, they have proceeded on a campaign of tearing the NHS down and replacing it with nothing. And all for this one goal of using our healthcare system as a cash cow for people like Sajid Javid, who has links with private healthcare. Surprise, surprise. When he became Secretary of State for Health and Social Care, it was reported that he benefits financially from his ties to private healthcare providers. A year ago, he signed off £1 billion to retain private hospitals, and that money, that's all it was for. It wasn't to pay for any treatment. It wasn't there to clear the backlog or anything like that. It was just money being paid to private hospitals as a retainer, so that if we need you in the future, you will be there. Well, we needed them at the time. We still need them now. How come we're not using them? How come we're not using that £1 billion for the healthcare? You know, private healthcare providers have made a fortune since the onset of the pandemic. Some of them were struggling. They're now well into profit. And they continue to be needed because the NHS has been run down so badly. It was unable to cope before COVID. Now it cannot even pretend to cope. You know, we used to talk about winter NHS crises before the pandemic. Now it's all the year through. We've had emergency situations in the summer. Critical emergencies declared during the summer when ambulances couldn't get out to people. You know, this was all a deliberate strategy going right back to David Cameron. This isn't even that recent. It's not even since Brexit. This is going back to David Cameron, who hired an advisor specifically on NHS privatisation. The public paid for the Prime Minister to have an NHS privatisation advisor. And he chose someone who didn't just have expertise, who was himself a paid lobbyist for private healthcare. You know, he broke the NHS up, making it harder for services to be linked up across the country, you know, preventing NHS trusts from linking services together. I mean, I can attest to this. You know, a few years ago when I was I was having some treatment, and my GP wanted to do blood tests, as well as the hospital where I was getting treatment wanted to do blood tests. And it was never the case that they could just one of them would do a blood test and the other one would just be able to go onto a system and find the results. No, they each had to do their individual blood tests on me because they couldn't link up. There's no system allowing my GP to link up to the hospital system because it was in a different NHS trust. Madness. It's so inefficient. So inefficient. Under Boris Johnson's watch, NHS trusts were turned over to private healthcare providers. When decisions are made by individual NHS trusts on how to spend the budget that actually stays in the NHS, it's private healthcare providers on the panel making those decisions now. Under Rishi Sunak, we've got the imposition of massive real terms pay cuts on NHS staff, designed to chase them away from the service after a decade of consistent real terms pay cuts. Can't have the NHS when there's no staff to run it. And it was all with this one aim in mind: persuade people that the NHS they love is not fit for the modern world. Yes, you like it, but it's not a religion. We need to be practical. We need to move on. Move on. Never mind that it was fine before they came to power. Never mind that other countries run excellent healthcare systems that are universal and free at point of contact. You know, no. They will point to countries where it's not. And never mind the system that they really wish to promote is the unregulated private healthcare system of the USA, the worst in the developed world. They see the UK not as a nation which they are put into government to empower. They see it as a cash cow to be drained, assets to be stripped for their own gratification. You know, the modern Tories, they had to pretend that they were pumping record sums in. You can't just underfund it and then go, oh, it's not working, because people would go, well, that's because you're not putting any money in. We're still paying the taxes. Why aren't you putting the money in? So they had to be able to pretend that they were pumping in ever greater sums of money, record amounts of money into this leaky bucket. But it was a lie. It's not record amounts of money. It's reduced money. Because when you take account of, and that's the oldest trick in the book, like not taking into account inflation when you're talking about your funding. No, you take inflation into account, real terms funding. When you take that into account, when you also take into account population size and GDP, which few people seem to do, I'm going to do something on that before the election. The Tories are putting in much less money into the NHS now than Labour did. But, you know, there is some reporting of it now. I mean, we had the Financial Times, but not a lot of people read the Financial Times. But there was a recent BBC Question Time, surprisingly, that presented a chart from the Institute for Fiscal Studies which shows annual changes in health spending, which did take inflation into account. It used the 2019 to 2020 prices. The difference between Labour and the Conservatives is clear. Only once have the Tories ever increased the budget more than the average. The green bars, by the way, were the coalition years. You know, red were Labour years, green, Tory coalition, blue, pure Tory. You know, and you look at it, there's only one bar there that's above and that's the average since the NHS came into being. And even that isn't really NHS funding. That will include the £37 billion for privatised test and trace, which didn't work. The extra money we spent on dodgy PPE contracts. The Operation Moonshot money that was given to Dominic Cummings. It'll include all that. None of that was NHS money. It was classed as it because it was healthcare money. None of it was NHS money. You know, something like this needs to be shown to more people. I keep saying Labour would be well advised to just put charts like this on their campaign leaflets. Don't put your messages on. No one's reading the message. They pick the leaflet up from the doormat and they take it to the nearest bin. Put a chart like that on it. Charts like that and be done with it. Sajid Javid is now saying that people need to pay to see a GP or to get to A&E in order to fund healthcare. We do pay. We pay for the NHS through our taxes. It's just the government do not pass on those taxes to the NHS because there's mates, donors, benefactors who want the money instead. But when the NHS was first formed, the principles were clearly explained to people. It would provide everyone, rich or poor, man, woman or child, with medical, dental and nursing care. No charges, except for a few special items, no insurance qualifications, but it said it's not a charity. We are paying for it. We're paying for it mainly as taxpayers, you know, but the point is that it is free when you need it to reduce the stress of being ill. You know, now we pay for prescriptions. We pay towards dental care. We actually do pay an extra charge for it. When I go to the dentist, I have an NHS dentist. When I go to the dentist, I pay. Yes, it's subsidised. Yes, there's public money going into it as well. But I pay an extra private levy. Now the Tories want to extend this principle to seeing a GP or a hospital. After that, it'll be more and more money, or more money for this, that and the other. And the money won't really be going to the NHS. It's like when you go to the hospital and you have to pay for parking. That money's not going to the NHS. That's going to the private provider. You know, they'll pump as much of that money as they can get away with to the private healthcare profits. They'll continue to say, well, the bucket keeps leaking. We need a new bucket. That's what we need. There's this marvellous bucket we've heard of. It's called unregulated private insurance, like those wonderful Americans have. The one that leaves a woman so badly injured from a collision with a train that she needs urgent medical care, but she begs passers-by not to call an ambulance because she cannot afford it. Of course, Sajid Javid is no longer Health Secretary or even a member of the Cabinet. But he was. And he implemented reforms with this mindset. He's not even standing as an MP at the next election, but he's still there for another year or so, lobbying hard. If the Conservatives won the next general election, well, he's a close friend of the Prime Minister. He will continue to lobby. You know, Sunak himself, it's not like Sajid Javid is the only Tory MP with links to private healthcare. Sunak himself, as Chancellor, flew to the US under bizarre circumstances one time because he held no meetings on government business, but he did meet American private healthcare providers. There were a lot of questions about that. Over the past few years, lots of cabinet ministers have been found to have links with private healthcare companies. or lobbyists employed by private healthcare companies. There will be others who've got no links themselves, but they are ideologically opposed to any form of nationalised public service. An ideology that's now running the show in the modern Tory party. There's a reason why John Major said that the NHS is about as safe with these guys as a pet hamster with a hungry python. You wonder if this is another sign of the end game for the NHS. 10 years ago, a senior MP wouldn't have got away with calling for a separate charge to access a GP or A&E. If they had, they'd have been roundly attacked by the Tory leadership. Shut up, you fool! You're saying the quiet part loudly again. Shush. But now, not a peep. Javid has said openly we should all pay an extra private fee every time we go to the GP or to A&E. In addition to our taxes. Taxes which, by the way, are higher than at any time in the past when the NHS was funded and working fine. And not a peep or expression of disapproval from Rishi Sunak or even the current Health Secretary, Steve Barclay. None of them saying, oh, that's his view, we don't agree. None, no, can't see anything like that. Now it's almost like Tory MPs now can openly call for the founding principles of the NHS to be torn up. That they feel they've done their damage, can now move on to the phase where it's openly torn down. I said back in 2019 after the general election, that's probably it for the NHS now. It's gone. I said, forget about it, it's gone. Finished. When Labour do come back, whenever that would be, they can try and build it back up again, but it is currently gone. At the time, I didn't actually think Labour could win the following election because they'd lost it too badly. So I didn't, in all honesty, think Tories would abandon all electoral strategy and lose their minds. I thought they'd be in power for another 9 years, albeit with a reduced majority for the second parliament, but still in a position to actually replace the NHS with their fully privatised model. I thought the name would remain. I don't think they'd get rid of the name, but NHS would just become the name for healthcare, not state-controlled healthcare. People keep saying, well, the NHS is under threat. And I go, no, you're not paying attention. It's not under threat. It's gone. It was under threat. Now it's gone. At least a third of all NHS funding, forget about the test and trace and all the extra pandemic spending, just the normal budget, a third of it, it's funneled through the NHS, but it just goes straight to private providers. What remains, the genuine NHS funding, that is now spent according to decisions made by private healthcare providers, people with an interest in how that money is spent, sitting on the committees of NHS trusts. The NHS is already privatised, it's done. The Tories have done it, it's finished. Their next step is persuading people that it should not be free at point of use. That's the next step towards dismantling it altogether. And that's what Javid is now calling for. But there we are. Those are my thoughts. Let me know yours in the comments below. Hope you found the video interesting. If you did, please click the like button. And if you'd like to support the channel further, the join button for memberships. And until next time, I'll see you later.